The inferior vena cava, also known as the posterior vena cava, is the large vein that carries deoxygenated blood from the lower half of the body into the right atrium of the heart. It is posterior to the abdominal cavity and runs alongside of the vertebral column on its right side. It enters the right atrium at the lower right, backside of the heart. Structure: the IVC is formed by the joining of the left and right common iliac veins and brings blood into the right atrium of the heart. It also anastomoses with the azygos vein system and venous plexuses next to the spinal cord. The caval opening is at T8. The specific levels of the tributaries are as follows: because the IVC is not centrally located, there are some asymmetries and drainage patterns. The gonadal veins and suprarenal veins drain into the IVC on the right side, but into the renal vein on the left side, which in turn drains into the IVC. By contrast, all the lumbar veins and hepatic veins usually drain directly into the IVC. Note that the vein that carries deoxygenated blood from the upper half of the body is the superior vena cava. Development: in the embryo, the IVC and right atrium are separated by the Eustachian valve, also known in Latin as the valvula venae cavi inferioris. In the adult, this structure typically has totally regressed or remains as a small endocardial fold. Function: transport blood rich in carbon dioxide from the lower half of the body to the right atrium. Clinical significance: health problems attributed to the IVC are most often associated with it being compressed. Typical sources of external pressure are an enlarged aorta, the gravid uterus and abdominal malignancies, such as colorectal cancer, renal cell carcinoma and ovarian cancer. Since the inferior vena cava is primarily a right-sided structure, unconscious pregnant females should be turned onto their left side, to relieve pressure on it and facilitate venous return. In rare cases, straining associated with defecation can lead to restricted blood flow through the IVC and result in syncope. Occlusion of the IVC is rare, but considered life-threatening and is an emergency. It is associated with deep vein thrombosis, IVC filters, liver transplantation and instrumentation. Trauma to the vena cava is a potentially life-threatening situation as exsanguination may occur rapidly. History, additional images. See also, atriocaval shunt, inferior vena cava filter, inferior vena cava syndrome, recovery position, superior vena cava, references. External links: Sins/1462 who named it. Eustachian valve, anatomy photo, 4013-0101 at the SUNY Downstate Medical Center. Posterior abdominal wall, tributaries to the inferior vena cava, SUNY anatomy image 8827, cross-section at UVPEM body 12A.